Very good. So, and so we begin. So today's topic is Take Action Now to Stop Sepsis. And we are so excited to have our two very, very knowledgeable presenters with us this evening. My name is Juanita. I work for the Spina Bifida Association. And with us today is Megan Sorensen. She is the mother to a 20-year-old daughter with Spina Bifida. And she is co-chair of SBA's Advocacy Committee, and she is a former chair of SBA's Board of Directors. And she has been a volunteer of SBA for a very long time. Megan is also a nurse with 25 years of experience in emergency, trauma, and critical care transport. She holds a specialty certification in emergency nursing and has, excuse me, sorry, we have people coming in too, in emergency nursing, and she has a special interest in shock and shock states, including sepsis. So she published and lectured on sepsis, and she earned her Bachelor of Science in Nursing at Creighton University and has a master's in Healthcare Administration at Bellevue University. She is an assistant professor at the paramedicine program at Creighton University and is regional vice president of Air Methods, which is one of the largest air medical companies in the world. And also today we have Mary Donnelly, and Mary was born with Spina Bifida, myelomeningocele, and she lives in Manhattan, New York. She has survived sepsis twice. She earned her bachelor's degree in human services and has a master's in professional counseling in Arizona. There, she was also a chief executive director of a holistic healthcare college at the age of 32, and she served on the board of directors for the Spina Bifida Association of Arizona. She's worked in various areas of higher education for 18 years, and she's really excited to now be able to combine that background and also now as a case manager for the Spina Bifida Association for New York State. So with that, I turn the evening over to Mary.
Thank you so much. And we are going to begin this evening with the lovely Megan.
All right. Well, hi, everyone. I'm so glad you had a chance to join us, and I'm so excited that we're having this conversation. We've kind of thought about this for a while, and we've chatted about it in different venues, and really over the last 6 months or so, we've realized that this is really getting to be a more prominent concern among our community, and that we haven't really said a ton about it. We tend to find out the hard way about sepsis, what it is and what it can do to us. So we're really excited that you're here and anxious to talk about this a little more. So forgive me if you know all this. We're going to just do a little talk about a little refresher on what exactly sepsis is. I could go into all kinds of things about the mitochondria and what happens at a cellular level, because I'm a super nerd when it comes to this stuff. But what I want to do is just give you an overview of what it does to your body, why it happens, and what we can do to recognize it and maybe even prevent it. So sepsis is really, what it is an extreme response to an infection. So you get an infection, there's an infection in your body and it's localized, it can be in one place. But when your body sees that there's an infection present, and it creates an immune response, and that's normal. That's what you want to happen. That's how you fight off an infection. But sometimes your body goes kind of crazy and sends more than enough help to fight off that infection. And when that happens, and all these mediators come to the infection site, they start attacking the good things that are going on in your body. And in essence, it just begins this cascade of events that starts damaging cells. So now your immune system isn't just fighting the infection, it's fighting the good things that you have in your body too. So that's what sepsis is. And most often sepsis starts in the lungs with pneumonia, in the urinary tract, or the GI system. So if you're a person with Spina Bifida and you look at that list of the 3 most common places that an infection starts that can lead to sepsis, kind of fall in a lot of those categories, right? I mean, how many of us are dealing with urinary tract infections on a regular basis? And how many of us struggle with bowel issues and end up, with bowel obstructions, or even some sort of bowel issue. So as you know, this is why we're really concerned about it in our community, because we're so susceptible to it, just because of the nature of spina bifida. The thing about sepsis is that it's dangerous. It's really dangerous, and it has a high mortality rate. It can lead to death. And so what's important is getting this information out there so that not only people understand what sepsis is, but that it's dangerous and how to recognize it early, because that's the most important thing you can do to stop it in its tracks. So a little ominous, a little scary, yes, but if this information will give you the tools you need to recognize something that you might have thought, oh, I just don't really feel that great, and kind of brushed it off, then that's our goal, even if we sound a little scary. All right, so let's talk just a little bit about the statistics around sepsis. So 1 out of every 3 patients who dies in a hospital has sepsis. So it's common. But the thing about it is, in nearly 87% of cases, sepsis starts outside of the hospital. And you think about, cardiovascular disease and car accidents and all the things you hear about that make people sick or kill them annually. At least 1.7 million adults in America develop sepsis annually. It's a lot of people, and it's common. And because of of those, nearly 270,000 people will die as a result of uncontrolled, untreated, treatable sepsis. There just is a point where it does so much damage, it cannot be reversed, and that's when people die from it. All right, so who's at risk for sepsis? Kids, they get infections, they get sick quick. Adults over 65, people with chronic health conditions, people with recent severe illness or hospitalization, and if you've survived sepsis, you're at a higher risk for reoccurrence. Your immune system's been just a tinge on the beat up side, so then it tends to over respond. So again, when we think about our population, our community, how we're impacted by spina bifida, we fall in a lot of these categories, right? So signs and symptoms of sepsis. We can think back a little bit, especially with urinary tract infection. I think that's the most common thing to use. There are times when you could have, most of the time when you go to the urologist, right, you probably have a colonized urinary tract infection. Everybody's got them. We're not necessarily treating them because they're localized and they're not making you sick. So that's why you have to really think about what those presenting symptoms of sepsis are, because you might go from not feeling like you're sick or having a urinary tract infection, you don't feel it, you're usually colonized, those kinds of things, to feeling crappy and kind of writing it off because, I just feel blah or flu-like, or just got a virus or something, to really sick really fast. And so that's why we really, really want to emphasize what the signs and symptoms of sepsis are. I'm going to tell you these are vague, right? And that's the thing about sepsis. That's why it can be deadly, is because the signs and symptoms are vague and easy for you or your family or anybody else to go, I'm just under the weather today, and be really sick. So signs and symptoms: elevated heart rate. When your body is trying to compensate, in essence, in septic shock, you're not getting enough oxygen to your tissues. So your body is trying to compensate by your heart beating faster. So the blood pressure is low, which means that it can't, and that's from mediated receptors. And when this happens, your vessels become very boggy. And, it's like a hose. If you have a hose that's a certain size around, there's going to be a lot of pressure coming out of it, and you make it bigger, it's not. The cascade of mediators that happens in sepsis causes your vascular system to go like this, for just, that's the technical term for it. And because the container is bigger, your blood pressure gets lower, right? And because your blood pressure is lower and your blood is what's delivering oxygen to your tissues, now your tissues and your receptors are like, wait a minute, I'm not getting enough oxygen to my kidneys, my heart, my brain. So epinephrine kicks in and your heart starts beating faster, right? And that's an effort that it's just, we're trying to shove all the oxygen to the cellular level. And that's why you see these signs and symptoms. So high heart rate, low blood pressure. If you have a blood pressure monitor at home, we can talk, it's good to know your baseline. We think that, if we're just talking about the average person, a low blood pressure is probably between, I would say if it's below 100, we would, that's when we would start worrying, but we want to know what your baseline is. Maybe you sit at 100. So those are things to consider. When you're healthy, just feel your radial pulse. What's it feel like? You can kind of assess that the amount of pressure you feel of that pulse on your fingers is probably what your normal resting blood pressure is. So if you're feeling lightheaded and not well, and you put and that pulsation doesn't feel as strong, that's your blood pressure. And what you're feeling is a lower pressure. So that's the old-fashioned way to figure it out. You get very feverish, shivering, feeling very cold. This is a combination of the infection and fever, but also the fact that now, because you don't have oxygen to your cells, your body shunts all of the blood to the core, to your major organs. So your skin doesn't get it. So that's why you feel cool, get clammy, you get this kind of pale color. And that's what's happening. Confusion, fatigue, like excessive fatigue or confusion, or you just can't really get it together like you usually do. Those are, especially in urosepsis, when we're talking about urinary based sepsis, confusion is in the emergency room, as an emergency room nurse, if I had somebody come in and they were a little cool and clammy and new onset confusion, and they had any risk factor for a urinary tract infection, it's immediately where you go. And it's, again, vague, but if you're not feeling with it, or your family's like, what is up with you? That's a good sign too. Any pain or discomfort, and that's also, again, vague. You might have some lower back pain if it's a kidney infection. You might just be achy. Just that general feeling of my muscles hurt and I just don't, it hurts to move. So again, really vague, but that's what we want you to look for. We don't want you to dismiss those kinds of symptoms when it could be something serious. And then shortness of breath. You'll also see you feel like you can't catch your breath, or you're breathing really fast. And again, that's the body's effort to get more oxygen into your lungs, to try to get more oxygen delivered out to your cells, because that's compromised at this point. So high heart rate, low blood pressure, feeling shivery, cold, clammy, moist, sweaty skin, some confusion, generalized pain or discomfort, shortness of breath, especially rapid breathing. So things to keep in mind. All right, what are we? Oh, now you've got all the facts, all right? So now Mary's got quite the story to tell you. And thank God we can all learn from her experience. All yours, girl.
Thank you so much, Megan. I was joking with Megan the other day and I said, I'm going to bring her into the hospital with me the next time I think I have sepsis or something going on. Thanks so much. So you guys, these next few slides, I am here to share with you about my story and provide you a true story of my sepsis experience, and one to help you identify personal signs you might have. And also to just hear a true life example, and also share with you some of my pictures from my journey of sepsis. Yay, are we excited? We're so excited about that, I'm sure. All right, so first I think it's really important to know that my experience with sepsis came from being born with the condition of the birth defect spina bifida. And normally when I say to somebody in the public that I was born with spina bifida, they say, spina what? I'll even get this from the doctors. They don't know what it is. They may have heard of it, but they usually got to go on the good old Google machine and get a better idea of what spina bifida really is. So for those of you, obviously a lot of you here tonight are impacted by spina bifida, but for those of you that maybe are new to hearing about spina bifida, I'll just give you a brief overview. It is the most permanently disabling birth defect that is associated with life in the US, and it occurs when the neural tube fails to develop or properly close while in the womb. So it typically occurs within the first 28 days of pregnancy or so. And it's commonly referred to as the snowflake condition because none of us are the same. All of our conditions are different, but it is a very complex condition. And you'll find that some of us are outwardly affected, some of us are inwardly affected, and some of us have both, where we have things are affected out and inward. So for me, it looks like I might function really well on the outside, but actually with having spina bifida, I have about 50 diagnosed conditions that stem from spina bifida or over and above and additional to that. So what does this have to do with sepsis? So being born with spina bifida, I have an ill-functioning bladder, which, as you can hear based on what Megan said, leads to that reoccurring bladder infection that I was having. And that bladder infection is what went to my blood and caused sepsis. So I had not sepsis just once, but twice within a 4-year period. And that's actually the very first time when I was diagnosed with it in my early 30s. I actually was the one in the intensive care unit Googling what is sepsis. That's one of the reasons I think it's so important too, that so few of us know what it is and that we learn more about it. So this is going to mimic a little bit about what Megan was saying for my signs and symptoms. You can see here, I'm at home. This is not when I got sepsis, by the way, but I'm at home. I'm all dressed up and ready to go out, but don't feel so great. That was the first time around. That's how I felt. And it really all came on suddenly. So I had a bladder infection, but I didn't have that typical smell you have with your urine. And there really were very few symptoms. So what I did start developing was a fever, chills, and mental confusion. And those chills were really what triggered me to be like, this is different. I need to go to the hospital, because they started to become a little more violent. They were not the type of chills I was used to. So once I got to the hospital, exactly what Megan was saying, I had the exact situation where I had a very high pulse or heart rate, but a very low blood pressure. And as we know, the pulse rate, the average person, I guess, is typically around 70. My pulse, the very first time I was in the hospital, was 178. So not 70, 178. And the second time it was 158. So clearly there was an issue. My blood pressure, obviously we know average, I guess, is 120/80. And my blood pressure the very first time was 98/52. And the second time it was 108/48. So the very first time I went into the emergency room and had these symptoms, I remember the doctor's face very vividly. He heard about my background. He saw this was happening in front of his very own eyes, and he was panicked. He really didn't know how to respond to it. And so it was right then and there. I said, get me a new doctor. I spoke up, which is so important when you're going through something like this. And thank goodness that doctor that came in was able to assess the symptoms of sepsis and was able to diagnose me with it. Didn't know much about spina bifida, but that's okay. We'll give him a break, but was able to diagnose sepsis, which was super important. So after that first time around, 4 years later, I was hospitalized with sepsis a second time. And this time it was actually because I did have a bladder infection, but they didn't treat me with antibiotics, which for those of us with spina bifida, we know can be very dicey on whether we're treating or not treating with antibiotics, based that we have reoccurring infections all the time. But I will tell you that second time around, I knew what I was experiencing. I walked into the emergency room and I said, I have sepsis. And they confirmed that that was the case. So with the sepsis experience in the hospital, if we wheel back a little bit to that first time, essentially I was in intensive care, and their goal was, we got to get the blood pressure up, we got to get her pulse under control. So essentially I had one arm receiving IV fluids, which you can see that arm there that says slow, because I have some sensitive veins, and we had to remind the staff of that. So they had to bring that fluid in very slowly, but I had a lot of it pumping into my body to keep my organs functioning. And on the other side, the other arm, I had IV antibiotics. But some of the takeaways from that fluid being pumped into my body was, where is that fluid going? And through my time there, I had swollen hands 2 times their normal size. I couldn't squeeze my hands. I couldn't grip anything. They were out of commission because that water was being retained somewhere. I also gained 10 pounds within 2 to 3 days because, again, that water had to be retained somewhere. And then finally, the biggest memory of being in with the sepsis experience was really the violent shaking. And unfortunately, it continued for quite some time, the first time and the second time. And what I really learned again from that is I had to speak up. I had to say, can you guys do something about this? And both times I had to do that. And finally, a doctor was sent in to give me something to relieve the shaking, which really can be very, very painful after doing it for several hours in a violent manner. So essentially, I was in the ICU and in the hospital. And then, of course, thankfully, gratefully, all my symptoms eventually resolved and the infection was treated. And, there's a lot of things that happen when you have sepsis. So those are just a few brief things that came to mind when I think back of when I went through all of this. And everybody, has some things that are different that happen with them. But I think one of the things that I was also very surprised about is the aftermath after sepsis. So essentially, the side effects of sepsis, and this is really how I felt about it. I thought it was a good picture of what I went through. Essentially, all of these side effects occurred after I had sepsis, every single one of them. And I really didn't even know what was happening because I wasn't educated about the condition. So I was extremely confused. I thought the infection was gone. And I think one of the biggest things that Megan said was, initially I had extreme weakness, just something I'd never felt that weak before. I had brain fog that lingered for months after. And then I actually had mounds of hair start to fall out. So a very difficult experience from start to finish. And so being that this is such a jolt to your life, such a thing you have to go through, obviously you start to think, what are the ways we can prevent this from happening again? And one of those ways being practical prevention, right? And I think these are some of the things that I took with me that were helpful. And one of the ways is rest in bunny ears, if preferable, is so important for all of us. I think I'm most guilty of not resting as much as I need to, but whether you have a medical condition or you have sepsis, whatever, it's such an important way to refuel yourself. Having a keen awareness and an inventory of every symptom. Because I knew what happened the first time and I had it written down, I could identify it the second time and then bring it to the doctors. That made a big difference. Also, being able to establish a quick connection with your doctor throughout your lifetime, taking immediate action when needed. And one of the things I do having recurring bladder infections is I have a doctor who has approved to have me have my urine taken once a month to see what that bacteria count is. And if it's too high than my average high norm, we typically treat to prevent this from occurring in the future. And then you can see here, here's my trusty home equipment as well to monitor what's going on at home for my temperature, my blood pressure, my pulse, got the good old thermometer, the blood pressure kit, my new favorite, the pulse oximeter. That's one of my new faves. And of course, water to keep flushing your body. So yeah, the entire process really makes you feel so out of control. For those that have gone through sepsis, they can really, I think, attest to that. And although I had like all this practical prevention, I just kept searching for more ways to prevent and recover. And so with, Western medicine and antibiotics and doctors, which is so important, I really started to become an advocate of holistic prevention as well, which I think is such a beautiful marriage. I'm not a doctor, so obviously, and so I'm speaking to you about my experience of some of the things I've done with some holistic ways of being preventative. So if any of these options you think will work for you, make sure to bring them up to your doctor first. But these are some things that really helped me during and after. One of them is biotin, and everybody I think is familiar with biotin, the supplement. It actually helped me regain all my hair back. I regrew it, and it's actually the longest I've ever had it in my entire life. So I was thankful for that. Also take 2,000 milligrams of vitamin C on a daily basis. That helps my bladder with the bacteria. Occasionally, also for my bladder to clean it out, I take what's called D-mannose. That's D-mannose. And then for cleaning the blood for sepsis purposes, I partake in eating quite often blueberries, green leafy vegetables, grapefruit, all those good guys there. And then a lot of you guys know that green tea is a great anti-inflammatory tea, as well as I take the supplements are well known for anti-inflammatory effects. And finally, the good old six bottles of water a day. Boy, do I try to keep on top of that. So those are just some of the preventative ways I keep myself afloat on a daily basis to try and prevent third time's a charm sepsis. That's the last thing we want to have happen or to have happen to any of you. And my story is not uncommon. There are many stories out there for those that have had sepsis. And so that's why it's really important now for Megan to share with us from a medical perspective, the importance of when you should suspect sepsis, what to do, and the tips for the Center for Disease Control and Prevention.
All right. Well, first of all, I think that bowl of berries, like everybody should have that in their life all day, every day. That looks amazing.
So good.
Right? Jessica, I saw your comment, and Lisa, I mean, you're right. It's the same story. Mary's telling her story. You're like, yep, that's it. Yes. I mean, Lisa, it's like, yeah, how frustrating, because one look at you and it should have been clear. And I think you both mentioned 2017, and I will say that the medical community has evolved on sepsis. It's always been around. It's not new. What is new is the level of awareness we have put on it, time to treatment. So we, especially in the emergency medicine field, are treating sepsis the way we treat traumas, strokes, and heart attacks. In that, I'm sure you've heard of STEMI, Dordacath time, all those time sensitive, the golden hour in trauma, all those time sensitive illness and injuries that we've like hammered on for years. Sepsis is now in that group, and hospitals are starting to, I wouldn't say they're in every hospital, but most hospitals have sepsis alerts. So if a patient presents and fits these criteria, exactly the criteria we've talked about, they call a sepsis alert in the same way they would call a trauma alert or a stroke alert. So we're making progress since 2017 for sure. I will say that's not necessarily everywhere, but so let's talk about when to suspect sepsis. I don't think I probably need to say it. I think we've said it enough. If your temperature is higher or lower than normal. So what I will tell you is in the early stages of an infection, you will get febrile, right? Get a fever, your temperature will be high. As sepsis progresses and that bacterial infection progresses, hypothermia is a common symptom in advanced sepsis, especially urosepsis. So don't think, oh, I don't have a fever. Don't think that. If you're cold or your temperature is 96.9, that's reason that is a sign or symptom of sepsis. So keep that in mind. Infection. I have signs or symptoms of infection. My urine's been gross. My gut doesn't feel like it's moving. I've had a cough. I've got a bed sore, or I've got a pressure sore, right? That's another source of infection that can lead to sepsis. So if you have something going on that could be an infection, that's on your list, right? Any mental decline, you're confused, sleepy, difficult to rouse, you're not acting right, not as snarky as you usually are. So, you know, and if your family notices that, you know, you might not notice it as much as the people around you do. And then extremely ill, severe pain, discomfort, shortness of breath. Even if you aren't aware of it, you know, I want to emphasize, if you have a source of an infection, great. There's not one person probably in this group that can't at any given time have a source for an infection, right? Not uncommon. So I think that box is checked. So even if you aren't aware of an ongoing infection and you have any of these signs or symptoms, seek action immediately. So then how do you do that, right? Like, how do you get people to listen? Well, first you want to act fast. If it's early, I mean, if it's during the day and you can get to your provider now or talk to their support staff, their clinical support staff, absolutely do it. But if not, don't wait. Get to an emergency room, get to an urgent care, call 911, whatever it takes to get medical action or medical treatment. And then use the word. So Lisa, I'm gonna be haunted by your story that you put in the chat. But if if you go into the ER now with that exact same scenario again, say, I think I might be septic. This might be sepsis. If people around you aren't getting the cues, use the word. And then let that team prove otherwise. Maybe it's not, but let's guilty till proven innocent on sepsis, right? Then, you know, like Mary was talking about, how can I get ahead of it, right? Like, this is scary and horrible, and I don't want to get this sick. If you get to this point, you're sick, right? And it's a lot. It's a lot to recover from. It's long, it's not easy, and it's scary. So first, prevent infections, right? You know, watch your urine, make sure your skin's how it should be, you know, all those kinds of, just try to do everything you can to prevent an infection. I think that's probably what we're all thinking about most days. And then, you know, practice good hygiene, right? Make sure you're washing your hands, make sure you're, you know, that you're not exposed to, you know, that you're covering your cough, and that, like, if you have an open wound or a cut or anything, that you're cleaning that and keeping it covered, using a little Neosporin, or it would, Neosporin did not pay us for that, but you know what I mean? Take care of any open wounds, and make sure, especially with us, that you're doing skin checks and you're getting ahead of those early. And then, you know the signs and symptoms, so that if you are heading down that road, you know it so early that, you know, antibiotics, which is always, right, the #1 treatment, like Mary described, is we want to get antibiotics on board to start killing the bacteria that's causing it, while supporting the cardiovascular system through the shock state. Tons and tons of fluids that eventually get third space, and just maintaining blood pressure and oxygenation until the antibiotic does its job and kills the bacteria. So the sooner you can get that process started, the earlier in the sequence, the less sick you will get. So you see any of those signs or symptoms, it's bugging you, you have any suspicion that you might be heading down that path, act fast. Get help, use the word, use the word, use the word. All right, Mary, what do you have? That's kind of what I got. There's some resources, I think, on the next slide. You know, there's the CDC website just has fabulous sepsis resources for the general public consumption. So there's some great just posters and things like printable PDFs. Literally, if you need a reminder hanging on your fridge with the signs and symptoms, go there, print it, hang it, do it. Sepsis.org is a great place to get more information. So, all right, Mary, do you have anything to follow up with? We can take some questions.
Totally. I think our motto for this webinar is say the word. Say the word. Totally.
Great. So, okay, so we do have a couple of questions. And a couple of these were actually submitted earlier. So I'm going to go ahead and read them. And so this is a statement / question. I was born with spina bifida and I've had sepsis twice. One time my white blood cell count was 60. I also have type 2 diabetes as well as spina bifida. And I use the Freestyle Libre system to keep check of my blood sugars, and it has been really life-changing. So the question is since there's a way to keep up with my blood sugar using a sensor and a smartphone, will there be a time when patients can keep track of their white blood cell count with something similar to the Freestyle Libre system?
Well, that is a good question. I mean, I don't think that there's anything on the horizon right now for that, only because, and the reason I say that is because a blood sugar change can be can be very, very critical in a very short amount of time. And so you need that constant information to just maintain your status. Whereas a white blood count, they fluctuate slowly over time, up and down. You never really, there's not a norm. So I do think that probably those sorts of points of care kind of things will be more accessible. I don't know if it'll be like Freestyle Libre accessible, but right now you can go get a test for a urinary tract infection in Walgreens, right? Remember when you had to go to a physician to get a dipstick, just a dipstick for urine? You can test for those kinds of things over the counter. So I think that might be what you see, is that ability to do some sort of home testing for, and I don't know whether it will be white blood count or it'll be something less invasive at home, but so I guess, so yes or no. I don't think it'll be as accessible as constant blood sugar testing, but I do think we'll start to see more ability to do those kinds of things at home.
Thank you. Another question from Mary. You mentioned a couple of supplements, and you also mentioned something called D-Manos, and I was just wondering if you could maybe tell us again and put it in the chat what the names of those were.
Most definitely, not a problem. I'll put the following in the chat. So biotin for hair growth, vitamin C for bladder infections, D-Manos for bladder infections, cleaning out the bladder, blueberries, green vegetables, and grapefruit for helping to clean the blood, and bromelain supplements and green tea for anti-inflammatory effects. And then just remember, I will put that in the chat, some of those things do interact with other prescriptions you might be on and things of that nature. So a good example of that is I take biotin, but I also have hypothyroidism. So that interacts with my Synthroid. So I have to be careful, which is my medicine for hypothyroidism. I have to be careful of how much I take. So just because it's a supplement doesn't mean it's just like, oh, it's a candy, I can eat it. You just want to make sure it jives with any other antibiotics or condition you might have.
So in your case, for example, did you check with your doctor how much biotin I can take?
I sure did, because otherwise what would happen is the biotin actually would counter, basically stop the Synthroid from working the way it needs to work, and when my thyroid wouldn't work as well.
And then your hair falls out.
Exactly. So it's like this terrible cycle. But all of these things are great if used in the proper manner.
The other thing I was going to ask you, Mary, was you mentioned that post sepsis you were struggling with your nails too, and the biotin has probably helped with that, right? I assume.
You know, I have to, these are not mine.
You're fabulous.
Thank you. So I have to be honest, because of the hypothyroidism and the Hashimoto's disease, I actually never get nails. My nails have always been brittle, but they just got even more brittle with the sepsis, unfortunately.
Right.
So I didn't find a trick for that one.
Yeah, but if you don't have the thyroid issues with it and you take biotin, you probably see your nails do the same thing your hair does.
Exactly. Yeah.
So here's another question that we had in advance. My 6-year-old daughter has been taking prophylactic antibiotics all her life. How important is it to keep doing that to prevent UTIs?
Oh, so that's a really good conversation to have with your urologist, especially at 6. I would sit down with your urologist and talk about the risks and benefits of staying on oral antibiotics. It's good, obviously, because it prevents infection. But what happens, especially with oral antibiotics, is the bugs just outgrow them, right? So then the bugs become resistant to antibiotics, and then it gets to a point where whatever infection it is, it's harder to treat. Now, your urologist is, at 6, the urologist is prescribing those. I think that, that makes sense. And every kid is different. My daughter's 20 and we switched to a bladder irrigation antibiotic when she was probably about 6. Now that I think about it, maybe a little older. And that way she doesn't do oral meds, but she has the infection prevention, and that's been fabulous. She hasn't gotten a bacteria that's resistant yet, but that was something that I researched, and I actually had to track down a urologist that would do it. It's a little more common now, but I would encourage you to have that heart to heart with your urologist. Like, is this worth it, or do we do a trial period off and see how she does? And because it's going to be inevitable. She's going to colonize, right? And she's going to have bacteria in her urine. That just is part of it. It's just that if her body can keep it under control. So that's super big answer to that question. But I think definitely I would stay on it. I think it's the right thing to do now, but also worth exploring together with your urologist to make the right decision as she gets older.
And about that, you mentioned, one of the things you mentioned, Megan, was, and I'm not going to get the term right, was it a cleanse, a bladder cleanse?
Yeah, we do an irrigation. Mm-hmm.
And is that also an antibiotic, or is it something else?
Yeah, no, it's gentamicin. We do a gent bladder irrigation, and it was pretty, I pushed it really hard when she was little, and 15 years ago, it wasn't used in children. And, I was willing to try it because she was developing many antibiotic resistant infections and had doing a lot of home pick lines and that kind of stuff. And so it's worked for her, and definitely worth asking about. Doesn't work for everyone, especially if there's no sphincter tone, because you have to be able to hold it. But definitely something to look into. Or if you've had a bladder aug, it also doesn't work as well. Well, I mean, it works, but this is going into all kinds of stuff, but what they use on when they use parts of the colon to augment the bladder, that absorbs gent. So right now, bladder doesn't absorb the gentamicin. Well, gent can be toxic, but because it's just in her bladder, it's not absorbed into her bloodstream. But when you add colon wall or small intestine wall to augment a bladder, now it's got absorption, and now it can be absorbed into our bloodstream. So it's super complex. But I would explore every option on infection management with your urologist, because they're also evolving in how they treat stuff too.
And we got a question about vitamin C. And would that dose of vitamin C contribute to kidney stones? I've read about a correlation between both, but is that true?
I mean, I'll just say that I have a ton of kidney stones all the time, regardless of taking vitamin C. So I don't know, Megan, is that true?
I don't know. I haven't heard it. I always try to think like, what will, you know, what it'll tell you is vitamin C will help you not get a cold. So that's really good. But I try to think of the things that tend to lead to kidney stones. And I always tend to think like they're things that are rocky, right? Things that you think would make you rocky, make rocks. I have to look it up. I don't know.
Yeah,
If you've read it, Jay, it's probably something. There might be some. I just can't think of a mechanism off the top of my head. But remember, I'm an emergency room nurse. We don't think this hard about anything. We deal with stuff and get it moving. Put it in the helicopter, off it goes.
Well, and then doesn't it make it depends too on like the type of kidney stone, because aren't they like crystallized by different things? Yeah.
Yep. So if you have one and they break it down, they're like, this smells like oranges, then it's probably the vitamin.
Oh my gosh, we're gonna have to look that up. I'm taking notes.
I have a question in here too that came direct to me about the threshold of the number of kidney infections and bladder infections per month. No. There just isn't. There isn't. I wish it was so magical. You've had 3, you have a higher risk of sepsis. That would maybe be easier on all of us, but no, because often people have just one big one, right? So not really. You could have never had a bladder or kidney infection your entire life, get one, and it leads to sepsis, or you could constantly be dealing with them and never get septic. There's just no rhyme or reason to it. It's really about how your body's inflammatory response, how it responds really to that overwhelming infection.
And I can add about the vitamin C and stones. It just depends on the kind of stones you form. I don't know that vitamin C is at all correlated with stones, but like that Mary and Megan said, your urologist, if you ever have stones, they'll let you know what you shouldn't take. Typically, it's about drinking more water and, keeping everything moving. And I think that's a very hard thing for all of us to do.
Oh, if only Diet Coke.
Right.
Oh, no.
Or that water in the coffee. If only that was considered some of it.
So I don't see any more questions. There were a couple of comments and experiences in the chat, but I actually did have a quick question, I think, that you can answer quickly. Mary, so you mentioned the side effects, the aftermath of both of the episode, of your sepsis episode. Was that the case for both times that you had sepsis?
It was. I did notice it was different degrees for each one of them. So where I think, I'm trying to think back now. I think oh goodness. Yeah, I would say it was different from each one, but I would say the one that always like remained the same, which was the most difficult for me, was the brain fog. That just lasted forever. And I could still do things, but you could just tell it took forever to get to like a sentence that normally would come to you very quickly. So to answer your question, yes, but all in various degrees each time.
And then also about that, so, because this is such an important thing, and, you've both given super great advice on what to do when you get to the emergency room or when the doctors see you. The second time that you had it, did you see the same doctors as you did before? And did you have to re-inform them?
Yeah, it kind of stunk because the first time I had it, I was in Arizona at Mayo Clinic, which I loved. And then the second time I actually was living in Manhattan. So I was at New York Presbyterian. But the second time they didn't get a chance really to mess anything up because I'm just like, I have sepsis, do what you need to do to figure that out because I know that's what it is. So it was tough because both times I had to like share with them what happened and give them all the details. And sometimes when you don't look sick, they kind of are like, no, you don't, you're fine. And you just kind of have to continue to advocate for yourself, or they don't think it's at that level yet. And it's like, well, do the test, do what you need to do, because I assure you it is.
Quick before we end, I just wanted, I wanted to get back to, I'm sitting here thinking, right? And I wanted to get back to Jessica for a minute when she mentioned that her son was 6 months old, was violently ill, and got septic. So that's one thing, we're having this conversation around, my blood pressure is low and my heart rate is high and I'm acting funny. And that, how that looks in children is, this kids get sick quick. They go from not sick to sick very quickly. They get sick very quickly. They compensate and compensate and compensate till they don't. Where you and I compensate like on this slope, they go, So,
Yes.
you know,
So
I think, yeah.
I just wanted to speak on it really quick. So like you were saying, Mary, where you had to advocate, I'm very in tune with Charlie, have been since he was first born. And I just knew something wasn't right. But I kid you not, the pediatric ICU and general peds were fighting in the ER because my son was acting normal. Never presented with a fever. The only way they found it was I demanded they do blood work.
Blood cultures.
I said there is something wrong with him. They gave him an IV antibiotics, 4 days, sent us home. Within less than 24 hours, he was a readmit. He ended up having to get surgery for vesticostomy or whatever. But yeah, it was. And it's hard. Yeah, he, like all those symptoms that you said, he had none of it. He just had a UTI.
Yeah, but looked, and you don't always know, right? With kids, you know, kids' heart rate is normally 120. It all depends on, you know, if he was 6 months old, it was probably 130. That's normal. So now you
Right.
gotta,
Well,
and who's counting that as a, you know, I'm not counting my
Right.
heart rate.
Well, and
So,
his temperature, he always runs low. So that never fluctuated. So like all the signs and symptoms that they were trying to tell us would have been septic, but his white blood count was like 122 or something. It was like when I tell you deathly ill, like, yeah. Yep.
Yeah, I think probably we should put that on our list because that's probably a whole nother webinar, right? Recognizing
exactly.
sepsis in children, right?
And
that's what I would say to parents is, if you think it's not right, use that word. That might not be what it is, but use the word.
And on that, Megan, just now you mentioned, so instead of asking for blood work, or like, should one say then like the word sepsis and then ask for blood work, or a culture, or both?
Both. I think, you know, honestly, if you say the word sepsis, that should, yeah. I mean, especially when you have a chronic condition of some sort, that should trigger cultures of every kind, right? Sputum culture, urine culture, blood culture, because you want to figure out exactly where that infection is coming from. And then along with your standard, you know, CBC, BMP, those kinds of things. But they yeah. Because you know, especially in the beginning, they're going to start broad spectrum antibiotics, right? They don't know, maybe they don't know where it is. They definitely know exactly what bug it is or what that bug's susceptible to. So broad spectrum antibiotics in the beginning, send all the cultures off. When those start growing on plates in the lab, and they put little discs of antibiotics in there, and then they smear whatever substance they took from you on that plate, and that bacteria starts growing, and there's those little antibiotic discs on there. And when the bacteria doesn't grow around that antibiotic disc, that's the antibiotic that particular bug is susceptible to. And then they'll switch whatever they're giving you to that specific antibiotic to specifically treat it. So that's kind of how that works. But it takes a few days to get that answer.
So I don't see any more questions, but I also did want to share, it was in the chat, the experience that Lisa was mentioning about how in December 2017, she had all of those cascading symptoms, and the hospital nurses didn't recognize it as sepsis at first. They asked if it was normal to have that high heart rate, for her to have that high heart rate and low blood pressure, and the fluctuating from the cold to hot. All the symptoms started as a typical flu, but my flu test was negative. It turned out that I actually had a severe bladder infection that developed into sepsis also. And then, she mentioned that I guess a year later in 2018, her ex-boyfriend passed away from sepsis that had developed from an infected pressure sore.
It's Lisa, that's classic.
And
I
I
mean, that's so
some urinary
classic.
symptoms.
Yeah.
You know,
Yeah.
it was a bad bladder infection, but I had no urinary symptoms, so they didn't think to check that at first.
Oh my goodness, even though you have spina bifida. So would you come in and say, do you usually have all the signs and symptoms of sepsis? Is in essence.
They said, is this normal for you?
Yeah, no. I like to perfuse my brain on a normal basis.
But I appreciate the fact that you said that one of the risk factors is a very recent previous hospitalization. Just 3 months earlier, I had been in the hospital with a shunt malfunction. So that last half of 2017 was not good.
Kidding. Oh, kidding.
And Lisa, I'm curious. So with Uric, when you had that experience, did you use the word?
I don't think I used the word sepsis, but I said, this is not normal for me. We thought that I had the flu. I had classic flu symptoms, but I had a very high temperature. I had a temperature of 103.
Yeah.
And my normal is 97. So I start feeling sick around 98.6, 99.
Yeah.
So it got to 103. I was like, I need to go straight to the hospital instead of the doctor.
Classic. Your story is absolutely classic.
When I was born, not only did I have spina bifida, but I contracted spinal meningitis on top of that. So yeah, doctors said, we don't know if she's going to make it through the night. So you might want to call your church now. So.
And candidly in children, so not so much in adults, but in children, especially infants, newborns, if they come in presenting with, signs and symptoms of infection, especially infants, we jump on possible sepsis in infants. Like if we pay that much attention like we do to infants, and when I say infants, I mean like, 4 to 8 weeks old, but their cultures are urine, blood, usually nasal and CSF. Always do a spinal tap because a lot of times that's the source of their sepsis. And so that's something to think. I mean, I don't think. I'm just thinking anecdotally, but it's in the adult population. It's going to be a lot more urine, colon, lung than it is some sort of shunt issue, especially if you haven't had shunt issues and you don't have some opening to the world. But in kids for sure.
Well, thank you both very much. Thank you, Mary. Thank you, Megan, for a really great presentation. I don't see any more questions, so we're gonna go ahead and stop. But I'm putting in the chat my email address in case you think of anything after this. Please feel free to email me, and I will be sure to share your questions with Megan and Mary. And so that's all we have. Thank you very much. I hope you have a good rest of your evening or afternoon.
Thanks, everyone. Have a
Wherever
great
you
day.
might be. All right, bye.
Bye, guys.